Oh, hi. I was practicing my script. So, hey everyone, welcome back to my channel. This is your own Dr. Spinach. Okay, so first thing first, a big apology for not being able to upload teaching videos. Nonetheless, here I am now, and I have decided to work more on my medical videos. Hence, I'm going to upload 2 to 3 videos every week. So please like, subscribe, and share to keep supporting my channel. It's the time that we should warm up our basic medical knowledge. So, I'm going to continue with pharmacology lecture I uploaded 3 weeks ago. For those who haven't watched Introduction to Pharmacology, can go back and watch it once to get an overview of the subject. Now, let's move forward with our next topic, that is routes of drug administration.
The content in this video has been taken from KD Tripathi, that is a standard textbook used in medical colleges all across India.
Well, there are various routes of drug administration. The choice of appropriate route depends both on the drug as well as patient related factors. In that sense, routes can be broadly divided into those for local action and those for systemic action. Let's start with local routes for local action. Local routes are used for localized lesions and for the drugs whose systemic absorption from these sites is very low, hence reducing systemic side effects and toxicity. The first one in our list of local routes is the topical route. It refers to the external application of the drug to the surface for localized action, and it is usually applied on the skin, nasal mucosa, eyes, ear canal, anal canal, or vagina. Drug forms include lotion, ointment, cream, powder, paints, drops, spray, lozenges, suppositories, or pessaries. Well, there are some drugs that are given through systemic routes, but they exhibit local action. For instance, there are some drugs like sucralfate or vancomycin that are given orally and they act only on GI mucosa without getting absorbed in the bloodstream. Another example is of inhalational drugs. That's again a systemic route of absorption for the action on bronchi, like salbutamol or cromolyn sodium. Another local route is through deeper tissues. Certain deep areas can be approached by using a syringe and a needle, but the drug should be in such a form that systemic absorption is slow. For instance, injecting hydrocortisone acetate in knee joint, that is intra-articular injection, or behind the eyeball, that is retrobulbar injection. The third local route of drug administration is arterial supply. When the drug is infused in the artery, it directly enters the target organ without having to pass through the heart, and hence isn't available in the systemic circulation. Certain anti-cancer drugs can be infused in femoral or brachial artery to localize the effect for limb malignancies. We have completed local routes of drug administration, which majorly included topical, deeper tissues, and arterial supply. Now, let's move on to the systemic routes of drug administration. Okay, so when the drug is administered through systemic routes, it is intended to be absorbed into the bloodstream and distributed all over the body, including the site of action. Let's begin with the most common systemic route, that is the oral route. It's the oldest, commonest, safer, and more convenient route of drug administration. Both solid dosage forms and liquid dosage forms are available in the oral route. However, there are some limitations to oral route. For instance, action of drugs is slower and hence it's not suitable for emergencies. Sometimes the drug is unpalatable, that is, it is not pleasant to taste. Drug may also cause nausea and vomiting. Next systemic route is sublingual or buccal route. As the name suggests, in this case, the drug is placed under the tongue or crushed in the mouth and spread over the buccal mucosa. So, only lipid soluble and non irritating drugs can be so administered. Absorption is relatively rapid action, and the chief advantage is that there is no first pass elimination. The examples of sublingual route include glyceryl trinitrate, that is nitroglycerine, buprenorphine, or desamino-oxytocin. The previous slide we mentioned that sublingual route doesn't have first pass metabolism. Now let's understand what is first pass metabolism. When the drug is administered through mouth, that is through oral route, it is absorbed by the GI tract and transported via portal vein to the liver, where it is metabolized, which then reaches the inferior vena cava through hepatic vein and to the systemic circulation through heart. And then it's available to the target organ. So, when we say that the particular route doesn't have first pass metabolism, that means it bypasses the liver and directly enters the systemic circulation. The third one is the rectal route. Certain irritant and unpleasant drugs can be put into rectum as suppositories or enema for systemic effect. This route can also be used when the patient is having recurrent vomiting or is unconscious. The most important thing to know over here is that about 50% of the drug that is absorbed into external hemorrhoidal veins of the rectum bypasses liver. So, only 50% of the drug is subjected to first pass elimination. The fourth one is the cutaneous route. Highly lipid soluble drugs can be applied over the skin for slow and prolonged absorption. Again, the liver is bypassed in this case. The examples of which include transdermal patches of nitroglycerine, fentanyl, nicotine, and estradiol, which are available in India, while isosorbide dinitrate, hyoscine are marketed elsewhere. The next one is the inhalational route. Volatile liquids and gases are given by inhalation for systemic action. Absorption takes place from the very vast surface of alveoli, and hence the action is very rapid. For instance, use of nitrous oxide and sevoflurane during general anesthesia. The sixth one is the nasal route. The absorption takes place through the mucous membrane of the nose. And again, the liver is bypassed. So, only certain drugs like gonadotropin releasing hormone agonists and desmopressin can be used through this route. The last one is the parenteral route. Conventionally, parenteral refers to administration by injection, which takes the drug directly into the tissue fluid or blood without having to cross the enteral mucosa. Par, that means beyond, enteral means intestinal. So you see, the drug action here is faster and surer. Therefore, it is valuable in emergency. Again, the liver is bypassed, so there is no first pass elimination. The types of parenteral route of drug administration include subcutaneous, intramuscular, intradermal, and intravenous. Each type targets a different skin layer. For instance, subcutaneous injections are administered in the fat layer underneath the skin. Intramuscular injections are delivered into the muscle at 90 degrees. Intradermal injections are delivered into the dermis or the skin layer underneath the epidermis. And intravenous injections are administered into the veins. Now, let's briefly look into various parenteral routes. First one, the subcutaneous route. It is richly supplied by nerves and hence irritant drugs cannot be injected, but is less vascular, so the absorption is slower. Some special forms of this route are dermojet, pellet implantation, and Cialis. The next one is the intramuscular route. The drug is injected in one of the large skeletal muscles, for instance, deltoid, triceps, or gluteus maximus. Muscle is less richly supplied with sensory nerves, and hence mild irritants can be injected. It is more vascular, so the absorption of the drug is faster. A clinical correlation over here: intramuscular injections should be avoided in anticoagulant treated patients because it can produce local hematoma. The last one is intradermal route. This route is employed for very specific purposes, the examples of which are BCG vaccination or sensitivity testing. Keep smiling because the last one is the intravenous route. The drug is injected in one of the superficial veins and hence it reaches directly into the bloodstream and effects are produced immediately. So the bioavailability of the drug is 100% in intravenous route, and this is very important. So, this completes our section for routes of drug administration. Thank you very much for listening to me. And in the next section, I'm going to discuss about pharmacokinetics and pharmacodynamics. Keep supporting my channel by clicking on like, subscribe, and share. Click on the notification bell down below so that you can get the latest updates about my videos.
Bye-bye for now.